Good morning and welcome back to another episode of 10 a.m. Tea with Natalie. I hope that you had an awesome weekend and I hope that you got your newsletter yesterday. Every Monday I send out a newsletter to all my subscribers just to kind of give you the latest recap on last week's 10 a.m. Tea so you don't miss anything. So if you haven't been receiving the newsletters, definitely send me a message here and make sure that if you haven't signed up, on the left-hand side of the business page, there is a newsletter sign up button. So make sure you click on that so you don't miss any episodes. All right, so we're continuing our conversation about exercise. Last week, we talked about why you should bother exercising. We talked about high and low impact exercises and different things there. And so this week, I'm going to kind of catch you up on how exactly you should approach starting an exercise regimen. So first and foremost, it's really important to consider whether or not your body's actually healthy enough to start exercise unsupervised. Okay, so what we are looking for here is like that there is a medical concern that, potentially leads you to be unsafe if you start exercising on your own. So what does that look like? Do you have a heart condition or have you had a stroke? Because if your heart is not healthy enough for exercise, that is something that then you should not be doing. That's something that you should be working with your physician to kind of frame what's appropriate and inappropriate for you and how to potentially be getting strength and things back in that way. This is not then something you should be taking upon yourself. Have you had a history of unexplained chest pain, especially unexplained chest pain with exertion? Okay, if you're having chest pain, that could potentially mean that there's something going on with the heart. And as I just mentioned, heart conditions make it not safe for you to exercise. Another aspect, do you feel faint or dizzy with physical activity? Okay, that's another sign that could potentially mean that oxygen is not getting to the brain. So that means we aren't getting good blood circulation to the brain, which could go back again to a potential heart condition there. Have you had an asthma attack in the last year? Asthma, means that you are not able to get oxygen into the lungs due to issues with breathing. So if you have the potential for having an asthmatic event, which could potentially be fatal, it's very important that that aspect is very much under control before you begin an exercise routine. Patients that have exercise-induced asthma or asthma definitely need to have their inhaler nearby in case of any emergency. So this is something that you're going to want to have a good conversation with your physician about before you move forward in starting an exercise routine. Have you had any issues with blood sugar in the last 3 months? So hypoglycemia. We do not want you to be passing out on the side of the road when you decide to go for a walk. So if your blood sugar has not been well controlled in that way, it is incredibly important that you're working with your doctor before you start exercising to get clearance that it is going to be in fact safe for you to be out there burning calories and exercising. If you have a tendency to be running really low in the blood sugar aspect, your risk of fainting gets really high. And so, if you're falling over on the street, potentially could hurt your head and then you have a head injury. These things are very serious. So these are things that we need to be thinking about. And then the last aspect is, do you have a history of pain or injury previously? If you have a pre-existing condition, and we're not talking health insurance, so let's not kind of freak out there. Good morning, Scott. Thanks for tuning in. If you have a history of injury or pain in a particular body area, make sure that you get clearance from your doctor to figure out what is okay and not okay in regards to physical training. If you have a history of back pain, potentially walking isn't going to be a big problem, but running could be. Potentially lifting weights and different exercises could exacerbate a condition or make it worse. So it's really important to make sure that you have a good understanding of what your limitations are. And if you're not sure you have a history of anything going on, please talk to a provider to make sure that you're doing exercises that are going to be really healthy and supportive of what you are trying to accomplish. So that's a summary of how you know you're safe enough to, or healthy enough and strong enough to work out. If you have any of those boxes checked, please, please, please talk to your provider before you start an exercise routine and keep yourself safe. If you think that the information we talked about here would help somebody else, definitely feel free to share this video to your page, tag them, share it with them in a private message. Definitely make sure to spread the word because safety really is what it's all about. And so tomorrow I'm going to check in about how a beginner should start an exercise routine, and then we'll just kind of work into things from there. So I hope you have an awesome day. Make sure you take good care of yourself. Have a glass of water, maybe go for a walk since it's springtime. The weather hopefully isn't too terrible where you are. And make sure to come back tomorrow. 10 a.m. Tea with Natalie every Tuesday through Friday at 10 a.m. Pacific, 1 p.m. Eastern. Take care, and I will see you soon.